Hi, everyone. Thank you for taking the time to listen today. I'm Natalie Sipes, and I'm a fourth year at KCU. Today, I'm going to be talking about an article that I did not write, but I found very interesting, and it is about the analysis of risk factors of pelvic organ prolapse in postmenopausal women and the construction of a prediction model. So, pelvic organ prolapse is a pathology where one or more of the pelvic organs falls from its normal position and bulges into the vagina. So, this can be the uterus, and this is called uterine prolapse. If it's the bladder that bulges through the vagina, then it's called a cystocele. And if it's the rectum, then it's called a rectocele. So, you can see images of all of those at the bottom. ACOG, which is the American College of not Osteopathic, Obstetrician and Gynecologist, says that the prevalence is about 25% of women in their 40s, 33% of women in their 60s, and 50% of women in their 80s, which is a lot of people. And the reason that I originally got focused on this topic was because I did a rotation in urogynecology. And so many of the patients we saw had pelvic organ prolapse, and so many of the surgeries that were done were to fix pelvic organ prolapse. And while I'd heard of this condition, I didn't know how common it was. And I, as someone in medicine, thought that I should have known more about it. And a lot of the patients that came in were scared because they didn't know what was happening in their body. A lot of them described it as their tumor or their bulge or their grape. So it could be very distressing for people to not know what's going on in their body. And so many people are being affected by it. So there's about 200,000 surgeries for pelvic organ prolapse annually. And the incidence is rising due to women's age increasing. Because as we'll talk about, increased age is a known risk factor for pelvic organ prolapse. So the article that I looked at is called, the title of this presentation, it analyzes risk factors for this condition. The questions that it answers are: what risk factors are most related to pelvic organ prolapse, and how can an individual's risk be predicted? So the methods in this study, there were 290 patients, all menopausal women or postmenopausal, and this took place between 2019 and 2022. These patients were split into people with pelvic organ prolapse and people without pelvic organ prolapse. 62 people had it and 228 did not. So single factor analysis was performed on the two data groups to see which risk factors applied to all the patients. And the risk factors were screened by multivariate logistic regression analysis, which basically means seeing which factors were most prevalent in which groups. And with that, the prediction model was created. And the effectiveness was analyzed through the goodness of fit test and the receiver operating characteristic, or the ROC curve. Okay, so the risk factors that were found to be statistically significant were older age, higher childbirth frequency, specifically vaginal deliveries, lower expression of estradiol, which is a form of estrogen, and then lower expression of vitamin D3, and lower blood calcium. It is important to note that all these other risk factors you can see here on the bottom right, those were also tested, but they weren't found statistically significant in this study. Several other studies have found that risk factors, especially BMI, are statistically significant, so there is some discrepancy there. But for the sake of this article, these ones on the top left are the only statistically significant risk factors that they used for their model. So this is the model that they created. So it uses a point system, and you can see the points at the top, and then the bottom is the risk of pelvic organ prolapse. So it uses their age. So this is using an example of someone who is 56 years old, and then that correlates with a point system of 30 points. And then if this person had had 2 vaginal deliveries, then they would get 34 more points. If their estrogen level was 24, they would get 45 more points. If their vitamin D3 level was 24, they'd have 40.5 points. And then similarly, if their blood calcium level was 1.4, they would have 54 more points. This adds up to a total of 203.5 points, and then a pelvic organ prolapse risk of 0.38, which mostly correlates with the prevalence that ACOG predicted. So this model has a sensitivity of 88.5 and a specificity of 84. So it is arguably clinically effective. So some explanations for the findings: the increased age. With increased age, you have weaker muscle tone, and tissues in general kind of start to degrade or get weaker. So the pelvic floor muscles and tissues are really what holds up all of these organs. And so when those start to deteriorate, that's when you find that those organs slip out of place, and that's what is pelvic organ prolapse. Also, vaginal childbirth causes damage to the pelvic floor support structures. Those muscles can tear, and especially with pushing, you're putting a lot of stress on those muscles, and just the added weight of a baby sitting in your pelvis. And then there are several estrogen receptors in pelvic floor tissues. So if you have lower estrogen levels, you have atrophy and decreased elasticity of those pelvic floor tissues and muscles. And then low D3 and calcium can cause less muscle contraction. If you aren't using those pelvic floor muscles, then that causes the muscles to weaken. So some potential flaws with this study is that the sample size is relatively low. They only had 290 patients that were studied. And so I think if this were expanded into a larger sample size, that could be pretty helpful. And then, as I mentioned before, there are some inconsistencies with other studies, specifically with risk factors that they found to not be statistically significant, especially BMI. And then there is still need for added individualization when you're applying the model. Just like with anything in medicine, I think individualizing plans of care is really important. And so even though this is a great way to tangibly give a patient a number of a risk, it is important to take into account all of their everything else that makes them who they are. So that kind of goes into the social determinants of health aspect of it, but just individualizing plans of care is still really important. So in conclusion, the risk factors for pelvic organ prolapse that were found to be statistically significant were older age, vaginal childbirth, low vitamin D3, low estradiol, and low calcium. The risk factors play a really large role in the incidence of pelvic organ prolapse. So as I mentioned before, I really became interested in this because I found there was such a big lack of just general education about pelvic organ prolapse. And the last pap smear that a woman gets is at age 65. And most cases of pelvic organ prolapse happen after age 65. So if a woman gets her last pap, stops going to see her gynecologist, it's very common for people to just not be receiving healthcare that's specific to their pelvic anatomy, and therefore be really confused when pelvic organ prolapse happens to them. So I think the weight of this kind of falls on the benign gynecologist to put out that education when the patients are in their office before they reach the age that pelvic organ prolapse is more common. And this can be targeted using these risk factors that we know, and that can change how much someone is counseled on it and who is being counseled on it in general. And this can really improve patient education as a whole. So additional research is still definitely needed in application of various education models regarding pelvic organ prolapse. I know one of the attendings I worked with on my Urogyne rotation is a big advocate for pelvic organ prolapse education being a part of family planning education, because a lot of people don't understand that having vaginal childbirth puts them at risk of this condition, solely because they don't know about it. So that concludes my presentation, and now I'll open it up to any questions.